huge shift happening in men's health. Testosterone therapy has grown fast, and honestly, it makes sense. More men are realizing that their symptoms aren't just aging, they're hormonal. So in today's episode, we're breaking down why male testosterone is declining, what symptoms you should actually be paying attention to, what the research shows about TRT, and how to do it the right way. So let's get into it, because understanding this now can save you years of feeling off and not knowing why. Welcome back to In the Gray Area with REVV Health. I am Britni.
And I'm Travin. And yeah, I have said this so many times that pretty much every man over 40 should be on testosterone therapy and can definitely benefit from optimizing their testosterone levels. And so, some people think that that's maybe like a crazy thing to say because not everyone's going to have the same symptoms and things like that when we get to that age. But when we talk about just like the disease prevention aspect of it, like that's what I mean when I say it's so beneficial, or every man over 40 could benefit from being on testosterone therapy.
Yeah, absolutely. But I think that a lot of people don't really even understand why they need it
Mm-hmm.
and just like what they have gone through in the last 10, 20, 30, 40 years
Mm-hmm.
and how these when we're talking about environmental
Yeah.
toxins and stuff like that is happening behind the scenes.
Yeah. We say this, all the time, but we used to talk about, hormone therapy and it being a result of like age-related decline. Now we're seeing it happen earlier and earlier. And a lot of it is because of, like you said, these environmental factors and endocrine disruptors and all these things that are contributing to hormone levels declining so much earlier in life. And, it's often why we see, sometimes we'll have a father and son
Mm-hmm.
come in and do their hormones together. And it's crazy because sometimes the father who's, 70 will sometimes have a higher testosterone level than the son that might be 40 years old. And it doesn't make sense to a lot of people why, but it's because, when that older man was growing up, they weren't exposed to all of these toxins and environmental factors that the younger generation has that have been kind of destroying their endocrine systems as they develop and grow up.
Yeah, it's really scary though, because what we are learning now is that these toxin loads are actually passed down generation after generation.
right.
So we have these babies being born with like a lot lower levels of hormones and not getting through the developmental stages that they should even.
Mm-hmm. Yeah, we see it play out all the time in real life. I mean, it's like we've been around even, kids in high school and even now younger. And it's just, I always kind of compare, and I say this to you all the time. I joke when when I was that age, and I just remember things being so different when I was a young kid growing up. And, I know everyone matures at different rates and things like that, but it does seem like there's an overwhelming kind of a slower maturity and slower to develop in terms of like these kids. Like they just for boys. Yeah. They just seem so much more immature at younger ages than what I remember growing up.
And I feel like it's opposite with these girls. I think these girls are just aging way faster than I did with all of my little friends back in middle school.
Yeah. Probably a lot of it is like we see a lot of increase in like PCOS with young girls and things like that. And like the adrenal hyperplasia that can, all these things probably not help, but contribute to helping, girls kind of seem like they're growing up faster than they should be.
Yeah, it is just interesting how not this toxic load, that's being passed down is affecting males and females so much differently.
Yeah, for sure. It's just, it's sad. And I fear for what's going to continue to happen, in the next generation. And it's like, cause it keeps getting worse and worse. And it's like, I hate, we do have some young men that we do have on testosterone therapy. And most of the time with young guys, we'll try to use things like HCG or something to kind of bring their natural testosterone levels up. And sometimes when that doesn't even work, and it's like, I almost, you don't want to put someone that's, in their 20s on testosterone therapy per se, but sometimes like that's the only choice that they have to feel normal and kind of function like a normal man should at that age.
Yeah, a lot of times too, even if we just get them onto like a detoxing program to help first and foremost and cleaning up their cells on that cellular level so they can even absorb what they're taking is really helpful, but it is really, really sad.
Yeah. And it's usually, we talk about this a lot, but it's usually when one hormone is deficient, there's multiple deficiencies and everything kind of works together and kind of like a symphony. But it's like, and then they'll have the testosterone levels that are low, and then it's usually low thyroid too and low adrenal function, and just like so many things that are causing these kids to not feel great.
Yeah, so the toxins definitely play a huge part in it. But then there's also like people are just not as active as they used to be.
Yeah.
And we see that in these younger generations, but it goes all the way up.
Yeah. That's the biggest other thing besides the environmental factors. I think just the lack of physical activity and the obesity that just kind of contributes to these declining hormones. I mean, the more body weight you have, typically the lower the testosterone level that you're going to have, that your body's going to produce. And so, there's just all these things working against these young kids.
It was interesting too. I know we talk a lot about PCOS for females, but when we just went to our conference not too long ago, they talked actually about how they want to change the name of PCOS and how men actually suffer from it as well. So it'd be interesting to see what comes of that, because insulin resistance is definitely a huge issue for both men and women, and it plays a huge part.
Yeah, I mean, everyone has it. It seems like, to varying degrees, but everyone, it seems like, is insulin resistant to some level, unless you really try to work on it and you have the hormones dialed in and you live the lifestyle and you're eating in that way to kind of be insulin sensitive. But yeah, I mean, it is interesting to kind of see what will keep unfolding and what we'll keep learning as science progresses and there's more research that's done with all this stuff.
Yeah, I just feel like things just keep on stacking up against everybody. Another thing, we always ask people, I know, even when they get started with us, they might in the beginning start to feel better and then they plateau. And a lot of times we go back to like the quality of their sleep and if they're sleeping well.
Yeah. I mean, we say it all the time. If you're not sleeping good, you're never going to feel right. I mean, if you don't get the rest that you need, you're always going to be kind of tired. And some people I know, it's popular in like the entrepreneur space, and people like to almost, it seems like on social media, people will almost kind of brag about like, oh, I run off of 4 hours of sleep or 5 hours of sleep and I'm working, all these hours and things like that. But I kind of wonder how true that is, honestly, when people say that, but also like, that's not something healthy to do. And it's like, you might be able to do that. And you might also, be functioning that way because you're on Adderall or stimulants or whatever else you're taking to kind of be like at this high performing level. But like definitely long-term, that's not something that's healthy and sustainable long-term. Like everyone should be getting, it's like we heard growing up, 8 hours of sleep, like that is still kind of the gold standard of what everyone should be aiming for.
Yeah. And after sleep, I know that one of the first things that we always ask is like, have you changed your diet? That's huge. Like eating healthy, exercising, we've gone over that, but also alcohol. It's like, it's hard. Like we'll get a lot of patients when they start and they're like, I just still feel horrible. And so when we start asking those questions, a lot of times, I mean, they're not just drinking like once a week, it's daily.
Yeah.
So that is going to play a huge factor on how well they feel.
Yeah, it's daily, or it's just, binge drinking on the weekends and then trying to make up for it throughout the week. And that's frustrating to me because almost certainly they're blaming the hormones.
Right.
Like they're saying that the hormones aren't working for me. And it's like you said, when you start digging into it, or you even, see them posting on social media that they're out drinking and partying all the time, but then they're, messaging you every Monday or Tuesday morning, like, oh my gosh, like nothing's working. Like I feel so tired. I feel so terrible. And it's like, dude, like that annoys me so much when people do that. Cause it's like no amount of hormones are enough to overcome an unhealthy lifestyle or to overcome, being a weekend alcoholic, whatever it is. Like you have to kind of do, like we say all the time, do all the right things and the hormones are going to work with you.
And being patient. I always say that.
Yeah.
It's just like, it seems like people are so eager because they feel so horrible in the beginning and they're excited. And then they aren't willing to like go through the whole process because you're going to have some ups and downs and there's adjustments that have to be made and you have to stay consistent.
Yeah.
That's important.
You do. And it's just like we talk about all the time. Life also happens. And
yes,
you're still gonna have ups and downs no matter what.
Yeah. So what do you think some of the top symptoms we hear that gets overlooked when people come to us and they're like, I've gone to my doctor and, I've told them that this, and this is wrong. And they say it's normal.
In terms of what gets overlooked, are you talking about just symptoms? We're talking about lab. Yeah. Symptoms. I mean, I think that, just probably mood is probably a big thing because I think a lot of people but a lot of people tend to associate it with like, if they're having trouble like putting on muscle or something, they'll think of testosterone. Or if they're having trouble with like erection quality and things like that, they'll think of testosterone. But when we think of like mood and even like symptoms of depression and things like that, I think that is very much tied into having testosterone levels. And I think that kind of gets overlooked a lot, especially in the, primary care medicine world where it's like everyone just gets an SSRI or an antidepressant medication. And it's like, you should definitely not be doing that unless you're at least testing hormone levels and testosterone specifically, because most of the time that will fix the issue. But I think like mood related symptoms are a big one.
Yeah. I think that a lot of people aren't aware of like even the fact that it helps so much with anxiety. We have that one patient of ours is in super good like health condition, but when originally he was coming to us, not our patient, super, super, super depressed. His doctor starts him on one SSRI, that doesn't work, so he ups it and then tries a new one, and then it was 10 times worse. And then he's more depressed than he's ever been.
Yeah.
And now we've been able to see him switch over. He's off of those, but on testosterone, and it's been life changing.
Yeah.
And in the areas that, yes, he is putting on muscle and he's definitely healthy individual as well, but just overall mood, incredible.
Yeah. Well, I think I'm glad you said that about the anxiety, because that's one of those other misconceptions that, to me, that goes along with, when people are very like temperamental and kind of have like that aggressive personality, or they're quick, they're short, like with their spouse or their kids or things like that. And like we've heard so many times from, let's say, the wife, that they are fearful for their husband to get on testosterone because they're already edgy, rude or aggressive or edgy, and they think that it's going to make it worse, or they think that their testosterone level is probably too high already naturally because they associate this aggressive type of like edgy behavior with high testosterone levels. And it's the opposite. It's always like the lower testosterone you have, the more irritable you are, the more anxiety you have, the more moody you are, the more quick you are to be short and like snap and things like that. And then we improve the testosterone levels, and then we see those things improve as well. And it's like, we had Levi on talking about the same thing, like where it's just like, oh, I'm so much more calm, and I'm so much more in control of my emotions, and I'm able to handle stressful situations better. And so that's probably a big kind of misconception that gets overlooked a lot.
Yeah, it's a huge misconception, but also sometimes it's a personality thing. I know that I've had a couple different wives come to me and be like, I think we need to back off on my husband's testosterone. And it's like, that problem was there before, and the problem is here. It's not necessarily the testosterone. Maybe there needs some counseling, some other things.
Yeah, if you're just an asshole by nature, I mean, testosterone is not going to suddenly change that. Like, you're still going to be an asshole. You're just going to have good testosterone levels. But like, yeah, you can't, that's the thing where testosterone is not going to change someone's personality. I always say it's going to make you a better version of what you are, because it's going to amplify the good traits, but it's not going to change someone's personality completely. Just like how, if you're just tend to be a jerk in general, testosterone alone is probably not going to fix that. But also, some people just are more, let's just call it like introverted and, reserved and quiet. And, giving that person testosterone isn't all of a sudden going to make him this like outgoing, energetic alpha male either. Like, it's not going to just change your personality, but, it does.
It gives you a sense of confidence too, though.
It gives you confidence, but that's different than what I think some people have this, false like impression of maybe the results they're going to get when they're on testosterone. Like, it's not going to turn you into a completely different person, right? But it will, amplify the good qualities that you have, for sure.
Yeah. Also, I know we hear it a lot, like with men especially, is like brain fog.
Yeah. I mean, I think probably every single person, well, not every, but wouldn't you say most people that come to us do, I mean, that's one of the things they say, like brain fog, or just mental clarity, or just not thinking as sharp as they used to. And like, that's super common. I mean, I dealt with that. I remember for years before I got on hormones.
I think a lot of times when these guys are going to their doctors too, they're hearing excuses from their doctors like, oh, you're aging, or, oh, like this is just part of getting older and stuff, instead of like actually addressing the issue at hand. And sometimes I know that we see when guys start with us as well, we always hear the excuses. They think hormones are the reason for every issue that they have in their life after they start. But they need to remember about the stress, the work, like all that kind of stuff they still have in their life, even though they're adding in this testosterone to help.
Yep, exactly. That's a conversation we have every day that we'll probably continue to always have, because it's just, it happens, and people, it's not a magic bullet like people think it is, but yeah, you still have life. And it's just like, compare it to when you're younger, when we were younger, and, you have these great testosterone levels, you still have bad days, you still go through things, you still have stressful events. It doesn't, shelter you from ever having a bad day.
Yeah. I think it's really important for people to understand the benefits of testosterone therapy, because there's so much research out there, so many studies that have been done. So maybe you can dive a little bit into like what the actual benefits look like, and maybe a little bit more of like the timeline of what people can expect when they start testosterone.
Yeah. I mean, testosterone's been used for almost 100 years at this point. I mean, there's thousands, if not tens of thousands of studies that show the benefits, plenty of long-term studies as well. But, we always talk about, we can call them the physical and the feel good benefits. That's what we talk about a lot. And those are things like, improved energy, improved mood, improved motivation, drive, outlook on life, improved libido, sexual function, improved muscle mass, lower body fat, all these types of things that we expect. But then there's also the actual health benefits, the side of things where it's like you're reducing risk of cardiovascular disease, osteoporosis, dementia, all these age-related diseases. And so it's seriously is such a wonderful tool for everyone, or a wonderful hormone to use. I mean, there's no other drug or medication or supplement available that does all the benefits that testosterone does, all in one. And there's no downside too. I mean, that's the thing. That's what's so bizarre to me, why it's still so stigmatized and it's not used more widespread. We're so quick to hand out statins and blood pressure medication and all these things, where it's like testosterone can also be a tool to help fix all that stuff. And you get all these amazing feel-good benefits over here as well.
And we see that. We see like in their follow-ups, which is only like 6 to 8 weeks after starting, that's one of the first things we see is their total cholesterol coming down and even their LDL improving and stuff like that. But also, I think a lot of times guys, like you said, think of muscle, they think of libido. And sometimes that scares the women because they're like, okay, so my husband already has a strong libido and now we're going to put him on testosterone.
Yeah. I get it. And I mean, that's, to each their own on that. And I certainly understand the perspective of if it's already, let's face it, like that is an issue in marriages that we see where they're not on the same level in terms of libido and the expectation of how often that they have sex or whatever. And I do understand where the fear would come from of like, okay, it's already maybe like an issue and now we're going to exasperate it with increasing libido. And it's like, I don't know what to say to that because we can't like carve that portion out of it. I mean, it is one of the things that comes with it. And so, all I can say to that is to just, for like we say all the time is both people should certainly try to optimize their hormones and get to, optimal levels so that at least that matches up. And if there's other issues outside of that, then yeah, I mean, that's counseling, that's communication between the two partners. I mean, that's something you guys need to work on, but
I think people need to understand that is very, very important for their overall health as well. So, I mean, even a lot of times, like people might have a great libido, but maybe their erection quality isn't great either. Yeah. So there's a lot more to it than just having a strong libido.
Yeah, for sure. I mean, yeah, it all ties in together. But I mean, to me, I would want to strive for that, in my relationship. I think, I view that as like a very positive and fulfilling thing. And so I understand maybe everyone might not look at it that way, but to me, that's just a huge benefit of it, not a negative.
Yeah. But what I'm seeing, like even from the female's point of view, is that a lot of times there is this mental compartment for them. Like, maybe their husband doesn't treat them the best. Yeah. Maybe there's some other things going on behind the scenes. So, to kind of like go into like the bedroom can be a little bit more challenging than just taking testosterone.
Yeah. And again, that's way outside the realm of hormones.
Totally.
Altogether.
Yes. Yeah. But I know a lot of times I've seen women come to us for that. Like they're hoping to get there and then we'll try. And sometimes just.
It's not what the expectation is.
No.
Yeah.
No. It is one of the first things I think that most women feel.
I do too.
When starting. But
I would say an overwhelming majority of women comment that very quickly, that they've noticed a huge improvement in that. I mean, to me, that's one of the main like symptoms that I noticed gets resolved more often than not, probably like the most consistent we see.
Yeah. So what would you say to someone that thinks that TRT is cheating?
I mean, I've addressed this before and it's like, look, I think that it's an amazing tool and I'm going to leverage any tool that's available to me to help, be as healthy and optimized as I am. And it's like, I don't know where, for the people that say that, where do you draw the line of what's considered cheating or what's considered like additive or not? I mean, are supplements cheating? I mean, you're taking a supplement to increase, something in your body or to increase performance or increase something. And so, I mean, that's what testosterone is, where we have declining levels and we're replacing it to optimal levels again. So, I mean, I don't know. It's certainly something that I would always do. I mean, I always will do it. I mean, it's just it's one of the biggest things that we can do to optimize our health as we age.
Yeah, overall. I think a lot of times too, like when I'm talking to people, I feel like we almost hear it from men more than women. Like, do I have to do this forever? Which is kind of interesting because they get so many benefits from it themselves. But like even going back to vitamin D
Yeah.
and explaining to them that that's actually a hormone and you
Mhm.
take that
Yeah.
and you're going to take that forever in order to get
Mhm.
the benefits, and kind of understanding that it works the same.
Yeah. And it's like, I mean, I say it like, do I get to take this forever? I mean, that's the
Yeah.
amazing thing. Cause when you think about medications that people are put on, so let's use, antidepressants, for example, and people typically will not have an issue taking those. And it's usually to improve your mood. You're having issues of depression or whatever, and they will help. But typically those kind of medications only help for so long, and your body builds up a tolerance to them, and then they stop working. And then you kind of are back to square one again. And you're like on this, like in the circle where it's like testosterone does not work like that. Your body doesn't build up a tolerance and you start losing the benefits. Like you're always going to continue to get the benefits of testosterone. In fact, over time, you get even more and more benefits. And so to me, like, why would you not want to take something forever that only does positive things for your body?
While you were saying that, it made me think of like, there is a difference between like what we're doing with optimizing your TRT versus like the bare minimum. And we see that a lot. And that is the difference.
That is the difference. I'm glad you brought that up. And that is so well documented in the data. And I don't understand why, other medical providers and people don't just choose to ignore that. But I mean, it's like, okay, if you look at, let's say like androgel, right? There's a lot of studies with androgel. That's the commercial gel that's used to raise testosterone. It's super ineffective. It's a 1% gel. But typically when you look at those studies, they'll take hypogonadal men, so under 300 total testosterone level. They'll raise it to like 400 to 600 typically. And they'll see either no benefits or very little benefits reported. And then if you look at the studies where they're using like IM injections and they're spiking levels to like super physiologic levels, 1,500 to 2,000, you see benefits all across the board, both in subjective and how they feel and in every sort, every health parameter that they're measuring improves. And so like, it's quite evident that the dose response is linear. The greater the level, the greater the benefits that you're going to get. And so when you raise levels just a little bit and you're kind of in the middle of the range, like, yeah, you're not going to get any benefit. And I think that's where a lot of people go wrong. They'll try it and they'll think it didn't work for them.
Well, they're going to try it first probably because maybe their insurance might cover it.
Yeah.
But that's what they need to understand too, is insurance is only going to play within those numbers and they're not going to have symptom relief.
You're not going to have symptom relief. Yeah. I mean, you have to raise levels sufficiently enough. And we talk about this all the time, that often when you're on, exogenous testosterone therapy, like oftentimes you need levels much higher than what you would need naturally to get the same benefit.
And originally, I mean, from my knowledge, they were giving like guys like a really high dose, like maybe like once a month, right?
Yeah.
And then it moved into like every other week and then once a week.
Well, with the cypionate ester that is used the most often, I mean, the gold standard used to be one injection every 2 weeks. And that's what they did for a long time. And they still, like, if you go to the VA, that's what you're going to get most likely. Like they're still doing it that way. And so that's why we get a lot of guys from the VA that come to us that feel like shit, because a lot of those guys are already dealing with mood disorders and PTSD and things like that. And so, and then you're spiking their level and you're letting it pretty much drop all the way down to zero. And they're on this up and down roller coaster on top of maybe like any sort of like instability they have anyways. And a lot of times like guys do much worse on TRT that way than if they just never did it at all.
Yeah, that's too bad. It's really sad.
Yeah.
But I mean, for us, most all guys are doing their injections at least like 2 to 3 times a week.
Yeah.
So keeping it spread out and more consistent and stable is really important.
Yeah. Yeah. I mean, I think when stability is so important, I think when we look at, when people have, side effects from testosterone, typically the side effects come from the fluctuation in levels. It's not from the testosterone itself, but it's from constantly going up and down. And so when you can do a protocol that keeps levels very stable throughout the week, like that's when you're going to get the most benefits and the best results.
We've talked a lot about testosterone, the benefits and stuff for men. A lot of times we'll see men get a lot of benefits from DHEA. That's a big game changer. And then thyroid. And thyroid sometimes we know goes misdiagnosed because a lot of the symptoms look the same as testosterone.
Yeah. I mean, it's like I said earlier, most deficiencies are a constellation, right? And so it's not just usually one. And so, yeah, a lot of times if you're deficient in testosterone, you'll have suboptimal thyroid, right? It doesn't mean that you're hypothyroid, but you have to look at it the same way as testosterone. Most guys aren't hypogonadal, but they just have suboptimal and they have symptoms. And so we treat it. And that same principle should be applied to thyroid, but it's not.
So I think a couple episodes from now, we're going to dive into like the benefits of peptides and when's a good time to introduce those and stuff. So we'll go deeper into that later. But I think one thing that we hear all the time, I hear it from both men and women, but men a lot, like they come to us and they're really worried about TRT because of hair loss.
Yeah. Again, one of the biggest myths around testosterone therapy is hair loss. And so I don't want to go into it now, but there's the whole saturation model that applies to hair loss, and that we can dive into that on a later episode, and kind of explains like the ins and outs of why testosterone therapy doesn't increase hair loss. But if you just look at the studies, there is a 1% increase in hair loss on men on testosterone, which is the exact same as what happens at baseline. So basically what that means is that when they look at the rate of hair loss for men not on testosterone therapy is the exact same as the rate of hair loss for men on testosterone therapy. So it does not cause hair loss.
Yes, but there's so many people worried about it.
Just like it does not cause prostate cancer.
Yes. But a lot of times, even when we do have them come to us and maybe they are experiencing some shedding, it's not usually the men, it's usually the women. But we always like to steer them back to thyroid. They need to be looking into their thyroid.
Yeah. And yes. And also, like, I think I said this last episode too, but, if we think about, the average age of men that get on testosterone, say in their 40s or whatever it is, like that's also around the same time where a lot of guys will start to notice hair loss and balding and things like that too. And so just because you're on testosterone and you are also losing your hair doesn't mean that the testosterone is causing your hair loss.
Also, it goes back to inflammation really is even part of the root cause of losing hair. There's many other factors, but taking testosterone is going to help when it comes to reducing the inflammation. The next thing that I think we hear a lot about is fertility. So guys are really concerned. Sometimes they might even be in their late 30s, early 40s, and they're not sure that they're done or not. And so they're at an age where we would just give them testosterone, but we have to have those conversations about what fertility looks like.
Yeah. And exactly. We don't need to get into all of the details of it, but yeah, there is, you give the men an option, right? You explain the options, and yes, when there is a risk of when you're on testosterone therapy, it's likely going to shut down your production of sperm, right? And it's going to make you infertile typically while you're on testosterone therapy. Not always, but there's a good chance that it will. Now, there's things you can do to combat that, and there's ways to bring it back online, like when you're ready to. And that's just a conversation that our provider has with the patients and lets them, know their options, and then they kind of make a decision together on the best way to move forward.
Yes. So there is a solution to
Absolutely. Yes.
Everything. Yeah. So I think that we both agree that there's really no risk and no danger with like adding in compounded bioidentical testosterone. You're only going to get a ton of benefits.
Yes. The only time that it would be a risk is if you have active prostate cancer. That's literally the only time that you wouldn't want to do it. Every other, there's no other contraindication for testosterone.
Yes. If any of this resonates with you, I just want to let you know that there is hope. There is a solution to your symptoms. And if you're having a hard time finding a provider, I would just really encourage you to take that extra step to find somebody that you can work with that you trust. And like always, thank you for joining us. Please like, share, comment, subscribe, and we will see you next time. Thank you.